Hi, my name is Santrice Booz, and I am a clinical pharmacist. I think I've always known that I wanted to do something in healthcare. Even when I was really young, I remember saying I wanted to be a pediatrician when I grew up. And then I went to undergrad and started working at a community pharmacy, and I absolutely loved it. And so in that moment, I knew that I wanted to be a pharmacist. So when I tell people about pharmacy, they typically think about who you see in a retail location like a CVS or Walgreens. I've done a little bit of everything that there is to do in pharmacy, from industry, working for a pharmaceutical company, to hospital pharmacy and retail pharmacy. And now I'm actually in what I think of as the combination of all of the things that I ever wanted to do in pharmacy. So I'm working in a primary care office, and we are helping the underserved patients within our local community here in the Metro Detroit area. So my day-to-day life on the job is not what you think of as traditional pharmacy. I actually support chronic diseases like diabetes, high blood pressure, cholesterol, and heart failure in elderly patients. So the majority of my patients are 65 years or older. So it's kind of what you would think of when you think of your grandmother. So they have a lot of different things going on. So like I mentioned before, the patients that we see in our primary care practice are mainly elderly patients. So the disease states that I usually help with are diabetes, hypertension, patients with chronic kidney disease or heart failure. So a number of different things. So things that you would think of when you generally think of like illnesses that affect older patients. I've actually been a pharmacist for 14 years now, and I've enjoyed every minute of it. I think the most difficult part of my job is the constant learning. I think anyone in healthcare will tell you that you have to constantly be aware of what's going on. There's so many changes in medicines and so many different changes in pharmacy laws. I'm constantly reading, constantly researching to make sure that I'm aware of anything new that comes to the market that may be beneficial to the people that I work with. My favorite part of my job is helping people. I think that's why I always knew I wanted to do healthcare. But now in the current role that I'm in, I think I have a really big opportunity to make an impact in lives of patients who have felt like they've been kind of left behind by the healthcare system for so long. So I really enjoy that part of my job. Ultimately, when I wake up every day and get my day started, my goal is to help at least one patient have a better experience with their pharmacy, with their overall healthcare, just with a better quality of care. So out of my job, I think, my goal is to every day have an impact on someone's life and make it a little bit better.